Anterior cruciate ligament, or ACL injury, is a very common knee injury among athletes and in most cases requires surgical reconstruction, followed by long-term rehabilitation. At present, the Limb Symmetry Index serves as the main measure for assessing functional recovery of the affected knee, but additional criteria are required to complement the Limb Symmetry Index when making return-to-sport decisions. In a recent study, researchers investigated whether knee isokinetic strength assessment, functional tests, and psychological evaluations at 6 months after ACL reconstruction could predict successful return to sport 2 years postoperatively. The participants performed 5 physical tests and completed 1 psychological questionnaire at the 6-month mark, then answered the return to sport survey 2 years after surgery. The study included 364 competitive athletes who underwent primary unilateral ACL reconstruction, out of which 179 patients were included in the final analysis. 53% of these patients achieved a successful return to sport. The predictive model included the conventional ratio, side hop test performance, and normalized performance on the single hop test for the involved knee. For the uninvolved knee, the eccentric quadriceps strength conventional ratio and normalized performance on the single and triple hop tests were included, along with the ACL RSI score. Based on this study, restoring the bilateral symmetry in knee strength and function, assessed through Limb Symmetry Index at 6 months after ACL surgery, was not predictive of successful return to sport at 2 years postoperatively. In contrast, strength and function of both the involved and uninvolved knees, along with psychological readiness, are significant predictors of a successful return to sport. Instead of relying solely on interlimb comparisons, focusing on the recovery for each limb independently, combined with evaluating psychological readiness, may enhance the return to sport decision-making process.